Hi everyone, my name is Kapil. I'm part of PSCI and IPD organizations. We just announced our first quarter results for financial year 23. It was a quarter where we saw consistent base business performance and we saw some upsides, which helped us record highest profit ever for the organization. This was also a very important quarter for us as we announced our rehashed ESG agenda and we also laid the footprint for innovation priorities for the organization. To reflect on some of these priorities and to reflect upon our results for the quarter, we have invited our co-chairman and managing director, Mr. G.V. Prasad, and he has joined us this morning to share his perspective on the performance for the first quarter. Good morning, Prasad. Thank you so much for taking time and speaking to us. So we just concluded our first quarter for FY23. What are your reflections on it? I think the quarter had some one-offs which delivered outstanding profit for us, but there were some concerns around the consistency on the base business. So your reflections and thoughts on the first quarter.
So there was some good news and there was bad news. The good news is the profits were very good. The bad news is they were based on one-time events which will not recur. And some of our businesses were soft. Especially the India market didn't do as well. The PSI business also underperformed, though it's on a turnaround mode. And overall, the profitability of the base was less than compared to the same period in the previous year. Also, of course, we had COVID products during the previous year. Be that as it may, overall, I think the base business has been soft in the quarter. We have a task. We need to revive growth and ensure that we come back in the base business with strong profitability.
Thank you, Prasad. This was a very interesting quarter for us because we rehashed our sustainability agenda. The goals are very ambitious, very audacious, and we also had our investor day where we called out our innovation priorities. So I'll first talk about the innovation priorities for the organization. How do you see the whole landscape of innovating for the core and innovating for the future? And what type of skills and capabilities you foresee would be required for operating in both to win in the core and then build a sustainable business?
Okay, the core is largely at this time generics, branded, unbranded, biosimilars, and of course services. In all these businesses, there are some fundamental value propositions which are very important. The first thing is getting the right products, selecting the right products, understanding the gap, understanding the patent expiry landscape, understanding the data, and selecting the right products well ahead of time. And this is very important. Once you're selected, I think the fundamentals of the business are very clear. You have to have a day one launch of every product that you make. And this operating system must be geared to that, to be first to market. And I've been repeating this ad nauseum over the last few years, but first to market is disproportionately important. The second thing is cost. It's a cost driven market. Generics are supposed to be affordable alternatives, and there's a lot of competition in this space. Hence, cost leadership. Your cost of goods sold should be the lowest in the market. Cost leadership becomes very important. The third thing is some of our markets are B2B markets, which means that the demand can vary quite a bit. So companies which are well positioned with a flexible and responsive supply chain can have a big advantage. The fourth point is having the right commercial model. Some of our businesses are B2B, some of them are driven by doctors' prescriptions, and having the right commercial model and tuned it well to meet the needs of the customer is important. So in summary, you need to be first to market, day one launches, second one cost leadership, third one is a flexible and resilient supply chain, and fourth one is the right commercial model for each market. If you do well on all these four counts, you're on your way to leadership in the core business. So this is how the core business functions. As you think of innovation and as you think of the longer term, we need to understand disease very well. We need to understand the indicators for disease, the conditions that you want to manage, and have a deep understanding end to end of the disease. Understand standards of care, emerging standards of care, so that you can identify the treatment gaps. And this becomes the blueprint for innovation, understanding what is the unmet need for patients, for customers, for doctors, and meeting that unmet need in a way which is profitable, and understand who will pay for that and how that value is shared between the customer and the company. And understanding what innovation is needed becomes very important as we think of the long term. And innovation is not one big thing. There are many things you could do. You could improve the standard of care by getting a product which actually makes a difference to the disease. You can make a difference in how the commercial model, how you engage with doctors, how you influence them. You can make a difference in how care, the continuum of care from diagnosis, treatment to post treatment is done. So there are various opportunities, but the key is to understand deeply the disease area and understand the unmet needs and work towards meeting those unmet needs and thus creating value and then claiming that value.
Thank you so much, Prasad. We had a lot of buzz and excitement around innovation days at Dr. Reddy's. We also had series of workshops. What are the spaces which we have called out as the next and the new?
So there are a number of different things which are complementary to what we are doing, especially in the branded business, which could be services to patients. So, looking at other unmet needs like outpatient insurance, things such as disease management, and various things, but these are all largely incrementally building on our presence in the market, in the branded markets. There's another whole area of how we improve therapy, and there, I think we are at the very early stages. We have made an experimental move into cell and gene therapies. We are building that line. That would be a whole new thing for us and for India, and that's based on a CAR T therapy, which we have collaborated with somebody in China, and we are bringing that to the market and making it more affordable for Indian patients in the space of lymphoma. That is one thing I would say is very new for us. The second thing we are looking at is, over the last 2 decades, we've built a pipeline of small molecules in immune oncology. This is in Origin, our 100% subsidiary in Bangalore. We are looking at how we can, uh, you know, do more of that work in the value chain. Right now, we partner pretty much either at preclinical phase or post phase one. And we are now looking at taking on more risk. And our recent partnership with EQRX gives us that opportunity to be involved in the molecules all the way up till commercialization by sharing the expenditure involved in taking this product to the market and also participating in the commercialization of the assets. So that's a slightly different way of participating. But ultimately, our ambition is to see if we can take our innovations all the way to the market ourselves. That would really be a new horizon for us. Beyond that, we are also looking at other areas such as services based on biology, based on our experience in map production. But we still have to figure that out, what infrastructure is needed, how we would do this. These are, I would say, some of the new radical innovation ideas that we are looking at. And of course, there are many things in the middle, building on our presence and adding innovation to our existing businesses to create new sources of revenue and value.
And any guidance on the footprint and the capabilities that would be needed to build this type of ecosystem within Dr. Reddy's?
I certainly think that as a company, we need to understand disease much better, the medical landscape much better. We need to understand the science of treatment much better. But if there are one or two areas where I would say that the company really needs to double down, there are two areas I would focus on. One is the new biology. Biology is evolving at a very rapid pace. We just saw last week the Google subsidiary DeepMind announcing that all known protein structures are now solved. That's a huge advance. Similarly, there are many things happening: high throughput experimentation, robotics, using artificial intelligence in the new biology space. Of course, they're happening across the value chain, but I see the advances in biology as something dramatic compared to the past. So that's one area. The second area where I think India and Indian companies have an inherent advantage is clinical development. If we can invest in these two areas of improving our biology capabilities and improving our ability to do trials at low cost to get evidence of efficacy and safety in a rapid way, these two would help us a lot in the future and as we create more innovative products and platforms.
Thank you so much, Prasad. Very, very energizing to hear innovation and a footprint for Dr. Reddy is going forward. I would move on to the ESG agenda. We are the pioneers in this space.
I don't think we are the pioneers. We've done some things better than others, maybe earlier than our peers in the industry, but we are not pioneers.
So let me rephrase. We've been ahead on the curve
Yes.
as far as some of our peers are concerned. We have recently unveiled a very bold and ambitious ESG agenda. Uh, how do you foresee that being implemented, and what are the roadblocks or challenges you envisage which we need to overcome as an organization?
I don't have all the answers to your questions, but let me start with the E part. The E part is about becoming carbon neutral and reducing our carbon intensity across the value chain, even going back to our suppliers, scope 1, scope 2, and scope 3. Here we have made a lot of progress, but there is a lot to be done. And it is not a straightforward journey. Just replacing existing power with renewable power is a good beginning, but it is not sufficient. Uh, Reducing our carbon footprint means many, many things. And though our goals look ambitious today, I think this is probably the minimal that every company needs to sign up to if we have to save our planet from disaster. You're seeing the huge impact of climate change is already upon us. This year we had record temperatures on the planet in many areas, especially in South Asia. Then we have huge loss of biodiversity. The forest covers have gone. India, though, has been generally not so carbon emission intensive or carbon dioxide intensive, but there is a huge amount of pollution in our country, which is not measured well. Most of our rivers are dead. As rivers pass through cities, they get highly polluted through sewerage. There's a lot to be done as a society, as a country, as the whole planet. And even though our goals look ambitious, I think they are kind of the minimal required today for our planet to be sustainable. So that's about environment. On social, we have two very ambitious goals: tripling the number of patients we serve from 500 million to 1.5 billion. This is very energizing to me because it also plays to our strategy of leadership in our chosen spaces. If we really have to be leaders, we have to serve many, many more patients. And to achieve this number, we have to go beyond the traditional things that we do. And I've seen recently that we are getting into access markets based on uh, multilateral agencies as well as big donors like Gates Foundation and all that. That's a very interesting way of expanding the pool of patients we serve. So these kind of ideas come in when you take a very ambitious goal to serve a large number of patients. Then we also said that we will bring three innovations which will improve the standard of care every year, of course, after a few years of working on it. That again is a very powerful driver of innovation. If we can really bring three innovations to the market every year, that's a huge achievement in terms of the therapy landscape. And of course, it will also increase the number of patients, so it will play to our first goal also. On governance, I think we're already okay. Of course, there is a inequity part that we have to correct, which is related to gender balance, number of women in leadership positions, and I see a lot of support for that within the organization, and it's also energizing. So as we think of ES and G, there are three very different things, and I think by embracing these bold goals, it will drive a lot of innovation, unleash a lot of energy in the organization. The next generation of young people who are joining the workforce are highly motivated to find solutions to the planet, to reduce inequities in society, and to build organizations which are fair, equitable, and trustworthy. So in that sense, what we are doing is for the next generation, and I'm very pleased that the entire organization is supporting this move towards ESG and sustainability.
Thank you so much, Prasad. That brings me to my last question to you. Uh, I've been following your reading list for a long time. What are you reading these days, and any insights or views from your side?
I read on a variety of topics, but I want to recommend two books to the audience today. One is Pfizer's CEO's book on the moonshot. And I have given this book to many of you guys to read. It was very inspiring to me how a vaccine came to being within 9 months of deciding to do so. It's a epic story about purpose, patient centricity, value of human life, and how a whole company rallied behind this audacious goal of bringing a vaccine to market within a year. So this was to me wonderful, and it was a testimony of what can be done through science and through tenacity, and for for a whole company being purpose driven and being very ambitious about it. And it was also a story of collaboration, which is amazing, between uh, the German innovator and Pfizer, and how they worked together seamlessly, and how they thought end to end till the product reached market on day one itself, and did all the risk management necessary. Uh, it was an epic story to me, and I encourage all of you to read that. The other book, I think this is more about deep science, and a company like us, which is committed to science, is about the autobiography of Jennifer Doudna, who was the Nobel laureate last year. Um, yeah, I think the book is called Code Breaker. It's about Isaacson. Yeah, Walter Isaacson, who's a master storyteller, talks about how she built this platform of CRISPR-based editing of genes, and how that opened up a whole new space of innovation. That, I think, is a very interesting story of how science advances through academic and research institutions, and how they work together to really push the envelope on scientific discoveries. And that was also very interesting. These are two books I would like everybody to read if they find the time.
Thank you so much, Prasad. It was very, very energizing, and we are very, very grateful for your time this morning. We look forward to working shoulder to shoulder with the leadership team to deliver on the ESG as well as the innovation agenda.
Thank you very much.